Okay, everybody, Dr. Keith here again with a very special visitor, somebody I met actually many years ago in my house in Palm Springs. Her name's Victoria. Victoria, just tell me, what were you doing in my house in Palm Springs? How did that come about? I don't remember, to be honest.
Well, I believe it was a mutual friend of ours, Colin Tongs.
Oh, yes, Colin. Well, in fact, I interviewed Colin for my podcasts. I said, I meet the Prince of Santong. He's really quite a character, as you know, and technically, I
Oh,
think
yes.
probably he could probably aspire to that title, technically. Anyway, folks, so this is Victoria DaCosta, and she has a considerable range of skills that I don't have. So I want to talk to her about this. Uh, Victoria, tell us about yourself, your dental work, what your technical title is, and all the good things that you do. Just give us, how did you get to where you are? Let's do it that way. What is your path?
Well, it didn't take long after I graduated from dental hygiene school, 4-year degree college from Idaho State University. And as a dental hygiene student, I always remembered our program director's comment on the first day of dental hygiene school. She said, "We can train a monkey to clean teeth, but we're going to train you why you're here to see patients." And her message never left me, and it was all about the medical and the dental health of the patient. And when I became a dental hygienist, fortunately for me, I was surrounded by European medical doctors. And my first year of being a professional dental hygienist, we had a case that the woman was 30 years old, losing all of her teeth, going into dentures. And I was really upset about that because I felt like I couldn't help her save her teeth, no matter how much treatments I gave her, how many treatments I gave her. And it was a European doctor that opened my eyes and said that you need to help her strengthen her immune system and strengthen her medical condition, and that will help save her teeth. We learned about it in dental hygiene school, but we really didn't go into details. And so we were pretty much doing a lot of clinical scraping and jabbing, but we weren't really looking at the swollen tissue in the mouth as something that their immune system was weakened, or they were deficient in vitamins or nutrition, or they were under a lot of stress. So that
Right.
was when I had my turning moment as a dental hygienist.
Well,
Start
it's
looking
great. I
into
mean, you said European doctors, if they were somehow better than American doctors. I'm not prepared to go into that controversy. It may be true, but it is a fact, isn't it, that German doctors, for example, are very aware of the whole person. In fact, they have practitioners who are not doctors, Heilpraktikers, they call them, and they take the big picture and the big case, which is what we're going to be talking about. So I'm really glad you had that experience. And I guess you're saying that was fairly pivotal, really. Just what did he call it? Just scraping and jabbing. That was it. And the point is, the mouth is attached to something, isn't it? It's you
Yes.
that's attached to you. It's not just a mouth. But that's one of the problems with all the medicine these days. There's a joke, as people get more and more specialized. The joke is that a specialist is a person who knows more and more about less and less. You have a toenail specialist, but if you do fingernails, they don't know anything about that. What fingernails? What are they? It's kind of that. It's jokey, but it's kind of like that, isn't it? So you learned like the whole patient story, and as I understand it from you, it was sort of fitted in with other models like the Chinese traditional medicine model and things like that. That it had a bigger picture on the stage. In other words, yeah.
Oh, absolutely.
Mm.
I had a lot of fun because once I learned how the neurological pathways were connected with the organs in the body and the systems in the body, whenever I, as a dental hygienist, would look inside somebody's mouth, I would see a filling on a tooth that was connected to an organ, and I would ask them, "Do you have problems in your stomach?" And they would look at me and how? Yes, I do. How did you know that? So I had a lot of fun. It was a game. I used to like
It
to
is, isn't
play.
it? Yeah, yeah. Something wrong with a person's insides. How are your kidneys? Oh, I had a bit of trouble with those. And your knees, I can't walk. How did you know?
Right. Yeah.
So, for all it's controversial, and Western trained doctors want to rubbish it all, there is something definitely something to it, isn't there? Like your
Oh,
canine teeth, your
absolutely.
gallbladder. When you've seen a bad
Definitely.
canine and the person complains of gallbladder trouble, there's something there anyway. Let's put it that way. It may not be the equivalent of rocket science, but it's wisdom. It's deep,
Well,
profound wisdom about nature and the body.
as just a layperson and not a professional dental hygienist, I always wondered why they called a tooth in your mouth an eye tooth, or your wisdom teeth had to get taken out. I never understood why a tooth had wisdom or why a tooth had to be called an eye tooth when it had nothing to do with that body part. At that time, I didn't know. And it was leftover information, I guess, coming from the East.
Right. Now, I'm guessing that this didn't go down well with your typical, Western trained dentists and
Oh, not at
other
all.
dental hygienic workers. They probably thought you were some kind of cook. Yeah.
I actually was fired 3 different times.
Fired for knowing too much or knowing more
For
than
sharing too much with patients, yes.
Yeah, yeah. Okay, well, I think we can agree between us that, dentistry is a very cavalier specialty. It's not about teeth. It's, as you say, it's about the whole body, really. And
Yes.
it's not just the effect the teeth have on the body, but it's the effect that the body has on teeth. And we really, we need to get this message out there. It's a holistic problem. In other words, it's not an enamel problem or a root canal problem. It's a holistic problem, and I'm very pleased with what you've done and that you've learned to become a specialist in this. Now, I know at about the time when we met, you developed a software package. Can you remember? To tell us about that. That was to help dentists who didn't really want to be helped, but anyway, you knew enough to be able to help them, and did they?
It's very true. And I have had an interest for IT since I was 17 years old. So by the time I was in my early 20s, when software started to hit the market and go into dental practices and digitizing their forms that were hard copies, I didn't see any section for recording patients' medical and dental health combined for what I would call the connection, the oral systemic links. And we learned, fortunately, in dental hygiene school, we did learn how to check for stiff glands in the neck and things that we call palpations, that I guess I pronounced it wrong. Palpitation is palpation.
Yeah.
And we were trained to check and screen patients for medical diseases that were showing up in the mouth. And when I took this idea to a software company that was producing dental digitalized forms, they thought it was a good idea until they asked 5 different separate dentists, and they all said, why would we need that information?
Oh my God. I mean, it's staggering ignorance and stupidity, and yet it's the norm, isn't it? Yeah.
It was back then. And that's how I got on if they weren't going to do it, I decided to do it. And I fortunate for me, my patients, I had a lot of IT patients, and they said, why don't you design it and build it yourself, and we'll help you. And that's how it started.
Yeah, that was great. Now, tonight, we want to talk about more than just teeth. I mean, we've said already it's a whole body thing anyway. But if we think about this part of the head and face, you're going to show some remarkable pictures, but there's a lot of things going on here, a lot of trouble. There's tonsils, there's adenoids, there's, sinus problems. Yes, dental abscesses, gum disease, jaw disease. I mean, gum disease alone is staggering importance.
Right.
So we know that certain, specific bacteria in the mouth can have strong impact on things like even the possibility of dementia and Alzheimer's. It's been mooted.
Well,
but gum disease,
yeah.
I mean, I have I put it in one of my books. It was originally Virtual Medicine. It's now been republished as Medicine Beyond. But at the start of the 20th century, the number one marker for death by heart disease was gum disease. If you had rotten pyorrhea gums, and a lot of people did, they didn't clean their teeth and, take themselves seriously. It was a very dangerous problem. But, at the end of the 20th century, it was still the number one marker for death by heart disease. Because, it's in the mouth, you swallow it, so it affects your microbiome. You're swallowing pathogens all the time. And they don't just go down your throat because you swallow saliva. They go into your bloodstream because, the bloodstream feeds the gums. So these bacteria can be anywhere. They can be in the brain, the kidneys, the liver. It's absolute madness to say it's not important. Why would we want that information? Why wouldn't you, really? So I think it's great. You're onto a good thing there. So I hope eventually you did sell some of the software units and make a bit of money for all your time and care and trouble. Yeah. Anyway, so now what we want to do is move forward a little bit, because the reason I'm excited to talk with you and had our good discussion last time was about an exciting new diagnostic procedure. You have a gun, as it were. You can point it at a person. It's a thermal imaging device, right? And I think a lot of people, especially a lot of women, know things about, thermal imaging for breast cancers and so on. It probably is better. They've heard of it, but nobody's, as far as I know, anyway, you're the first person I know of or have met that was actually using it to evaluate oral health and hygiene, or in fact, facial health and hygiene, as we said, not just teeth, but anything going on around here. So talk us through that a little bit. I believe you've got one nearby on your desk, I hope. Just show us quickly. But we want to see the results of it, not just the device. Yeah, show us what it looks like.
Sure. It's a small camera. It's handheld, and my students call it the gun because it looks like a gun, because it has a way to
trigger even. Why not?
Yes. Yeah. And then the camera is an infrared camera, so it's very sensitized to the temperature in the room, and it has a small screen, but you can see I don't have to learn a lot of buttons to push, which I like.
Yeah.
And I like the fact that it's light. I've tried other types of cameras. This is fairly affordable for anybody going into the dental profession or even medical screenings, but it's very easy to learn and navigate with and pick up the images. And it was designed actually for construction workers, because they were out on the road and they're industrial. And
so looking for what? Cracks in girders and things like that kind of technological thing.
Yes. And so because Infleur is one of the manufacturers of infrared cameras for almost, I think, 30 years, they started with military infrared imaging on the guns, night vision. And but infrared is something we have every day. We don't even realize that we're around thermography imaging. The weather report at airports, COVID, the thermometers are actually thermal imaging. The forehead when they check.
Oh, the ones that point at you when you go into a restaurant, say, "You, we don't want your sort." Yes, of course, that's true. So, for the listener, I have a lot of practitioners, and they're going to be very excited about this. And in fact, I insist that all doctors and DOs and chiros and everyone that follows me should get one of these devices, because it will tell you if the person is inflamed. We're going to see some fantastic images shortly, and I think everyone should have that. But anyway, for the lay people that are watching this, so infrared is heat, basically. So it's showing slightly warmed up parts of the body, right? And if you had a sore throat, this part will be, fiery red or yellow. It would look awful.
Or fever.
Whereas the rest of you, fever wherever. Yeah. Anyway,
sorry, one of the things that I love about thermography that I didn't know when I came into it was your body gives out signals through the skin and heat rises. And a lot of times we tolerate pain or we tolerate discomfort, not realizing that that's a signal that the heart is weakening or the kidney or the liver. So we could, for years, have this chronic inflammation slightly showing up, and thermography will pick it up at the earliest stage, 8 years to 10 years before it has a symptomatic breakdown. And what I love about it is that I can help with earlier screenings and clues, and then tie it in with the teeth to say, you've had a cavity on that tooth, the neurological pathway to that organ has been weakened, shows up on the scan, on the thermography scan. And I pull it all together, and they can now work with a practitioner to heal earlier than later. And all you hear these all of a sudden heart attacks, or all of a sudden, diseases or brain aneurysms or Parkinson's. Yeah. That's all easily picked up years earlier with thermography.
Well, modern doctors think, you have a heart attack. That's the beginning of the problem. You've now developed, it's the end of the road, not the beginning. The body's been doing its best and coping and patching up. And then all of a sudden the body goes, I can't do this anymore.
Exactly.
And the symptoms start.
Yes.
And if only doctors understood that model, they'd want to act sooner. But again, to be clear for the lay followers, inflammation is deadly. It's one of the number one mechanisms of aging, and if you've got inflammation running rampant in your body, sooner or later you're going to get sick, probably sooner. And if you don't deal with it, it can be disastrous. Some of the inflammation processes are just absolutely lethal if you don't deal with them. So anyway, we want to have a look at this. All right, can you perhaps share your screen and start showing us some examples of what you can do with this amazing device?
Sure. Well, when I designed the software, I designed it to develop a reporting system and using algorithms and scoring. And so basically what I've designed here is a way to show areas of the body sooner than later that they should pay attention to. But before I even start, I like to ask the patient what their complaints are and find out what's really been bothering them for a while. That they.
You mean you talk to the patients, honey? What?
These reports take about an hour and a half. I don't just quickly scan them.
Yeah. No, I used to spend well over an hour.
Yeah, I take the images inside their mouth, and this is an area a lot of doctors overlook, even dentists and even dental hygienists. We're trained to look, but we get lazy and we just ignore it, and until it's advanced.
Right.
And even areas that have the teeth that are worn down, and unfortunately, this person that I'm showing you here has since passed away 7
Well, we're not
ago.
seeing it, so don't forget to share your screen and then talk us through it. In fact, can you show us a couple of general cases first, perhaps? Start with a screen share, though. We're not seeing your screen, so.
Oh, it said, I thought it said share screen, so.
Oh, I've got to make you, no, I've got to make you into I've got to make you a host. Naughty me. Yes. I'm sorry, sweetheart. There you go.
When I hit OK,
so you're now a host.
Okay.
And you don't need to ask my permission. I think you just share. Yes.
All right. Now, okay. I knew I was missing something. Okay, here we go. So would you like to see the images of cases, or a few cases, or just one in particular? Or
no, a few, some samples. Last time you showed me a few to give an idea of, the different range. Obviously, you're concentrating mostly on the head, but there's an awful lot of things can happen around there. That it can be more the neck, more the ear, or more the forehead, and so on. So really, this is part of explaining the device, just so it shows some general pictures. And then we'll go to one particularly fascinating case, because it really is extraordinary what you found and the consequences.
I have been able to image over 5,000. Over 5,000.
Well, that's fabulous. Listen, when you do screen share, you've got to pick the right screen, otherwise
right. Right now I'm just looking for my different types of reports. This is,
we got some. No, right. Okay. So, but this is not thermal imaging yet, but
no, this is part of collecting the information for the imaging.
Yes. Oh, listen, I know what that is. You just walk past that. Just go back to this is the Chinese traditional medicine organ model, where certain teeth lie on certain meridians, like I was saying at the beginning, your incisors are over the kidneys and so on, kidneys and bladder. Just talk us through, we're not studying for a diploma here, but let's make sure the people who are watching understand what you're saying about the relation between different teeth and different organs.
Well, I think what's the easiest way to explain is people are familiar with dental x-rays.
Yeah.
And so I start there when I can show them a picture of a dental x-ray and help them understand that the little dark area inside the tooth is their nerve blood supply.
Yeah, the pulp, yeah.
And in the pulp chamber and actually the canal where the nerve comes through. And every tooth has its own blood supply and nerve that loops into through the head and the brain area, through the spine to get to the organs. And just like your eyes, this is an example I use with patients all the time. When the whites of your eyes are yellow and they're not white anymore, doctors immediately know your liver is not working.
Yes, jaundice, that condition is called.
Jaundice.
From the French jaune, which means yellow.
Yes, and their teeth are no different. So if the teeth are showing signs of decaying, there's something wrong inside the body.
Right.
And the chart illustrates how everything is connected through the neurological pathways.
So the eye is connected with the liver. I'm asking you. No, it's not a test.
There's your eye tooth, yes.
And what else have we got? Well, yeah, the molars there. So heart and spleen at the back there. Those
molars,
yeah.
And stomach, thyroid. And your third molars, you can see, are the heart.
Yeah, so that makes your wisdom teeth quite tricky and dangerous, doesn't it? People often get them messed up because they've got misformed jaws. There isn't room for your wisdom. They're big teeth. They're huge, big chunkers, right?
I have been taught since by a international chiropractor who teaches dentists to work with chiropractors to widen the skull bones so that the wisdom teeth have room to come in, because taking the wisdom teeth out on a regular basis disrupts the flow of the heart neurological pathway.
Right. And so I don't know, maybe something to do with the fact that heart disease is such a problem. But of course, the average doctor or the average dentist would just laugh and say, what do you mean widen the jaw? That's baloney. You can't do that. Everyone knows you can't do that. But you can, can't you? I mean, the skull is very plastic.
Yes.
And John Upledger and other people have shown that by molding the skull, you can change its shape considerably. It's not rock hard and formed for life. That's just not true. It's quite plastic.
And if you're chewing on and you're chewing on your teeth and they're not in alignment, you can have inflammation in the skull bones and in the neck, not just your jaw.
Right. That's really, that's awesome. I didn't know that. Any more pearls like this, sweetie?
Yes, and it also can affect your hips and put you into poor circulation in your hips just by not chewing right, or people missing teeth and don't get the stimulation to the brain. The nerves are stimulated every time you chew.
Yeah. There's been an interesting book came out last year. I've forgotten the author, but it's called Breath. Did you read that? Because he did a lot of research into the jaw, the opposition of the teeth, mouth shapes, palatal arch, and so on, and how that's influenced our ability to breathe and breathe healthily over the years. And chewing came out to be practically the number one factor in orofacial health. If you chew right, basically everything starts to work the way it should. So that's pretty awesome. Yeah, one more example, and then before we go on and look at some images. Well, top and bottom jaw is pretty much the same, isn't it? Except the heart and large intestine cross over a little bit.
Right, a little crossover.
Yeah, yeah. And you've got sensory organs here as well.
Yes,
like the front teeth, that's
really
adrenal gland as well as kidneys. But look, I didn't know that. Well, I did, but I mean, I wouldn't have known that as a budding doctor. Frontal sinuses, not the maxillary sinuses. These are at the side here. But the sinuses here, the frontal sinus, and those can be a lot of trouble because the back plate of those sinuses are right slap bang up against the brain, like a millimeter or two from the brain. So if you've got a sinusitis running there with bacteria, it's already practically in the brain, and a brain abscess. It's very nearly there. It's very dangerous, and yet people don't get it, do
What they don't realize, in these materials that go on the teeth don't just stay put, they leak.
they? Yeah, they well, they leak chemicals, but also capping, we know, is not good, don't we? If you put a cap on, it stops the
Right.
proper breathing and metabolism of the tooth, which has liquid flows going through it. And if you block that off, then very quickly you've got a dead tooth, even if it wasn't dead to start with, because you've
Well,
isolated it and poisoned
yes,
it.
and in regards to the chewing, Dr. Robert Walker is who I'm talking about, and he created his courses Chirodontics. Very
That's a
famous.
clever one, yeah.
Yes, and he opened my eyes because when dentistry first came out, it was in the United States, it was your barber, right? That's why they had the red and white outside there.
Bloodletting, yeah.
That
And in
they
it, I don't know if you
extracted
know, but in England we got a very snobby way of addressing surgeons. It's doctor this, doctor that, professor so
Right.
and so. But if you become a surgeon, you then must be addressed as Mr. Thompson, and it means you've arrived, because the surgeons were originally just barbers and butchers and people who
Well,
could wield a knife, basically.
right. And what was interesting is dentistry, when it first came into the schools to become authorized as, official dentist, the patient was always sitting up. And so all the dentistry, the patient was sitting up, and the dentist had to kind of, bend over and look inside the mouth, and got backaches and neck pain. Someone came up with this grand idea about laying the patient down. So now it's easier on the doctor to do the dental work, which it's true. But what they found out later, and this is Dr. Walker, is that as they're adjusting your bite, laying down, that's not how you chew. So, and most of the time you're numb. So you don't know that your chewing surface is not corrected right. Because if you just had dentistry done, or a filling or a crown, and you have the anesthetic wear off, and sometimes you feel it, and you go back in and you say, it feels a little high. But what happens is they adjust it with gravity pulling your jaw down. So as you are chewing, sitting up and chewing all the time, there might be a little discrepancy you're not aware of. And then maybe a few days later, a week, you have a low back pain or a neck pain, and you just don't realize it's tied to that biting surface that was malaligned.
Right. Now, I talk often, as you know, about the question doctors never ask, ever, which is, when a patient's sick and has just presented with some problem, have you been to the dentist in the last few weeks? They never ask this question, because they'd be blown out of their minds if they did, wouldn't they? Well, yes, as a matter of fact, and an adjustment. And, the next day I woke up with back pain. The most extreme is one I put in my book. It was a lady who was having a post crown, and the dentist put the tooth into the hole, in the drilled hole in the tooth, and she screamed. He said, "What's the matter?" She said, "I can't see in that eye." He took it out again, and the sight came back. So he tried again. He put the post into the tooth root, and again she cried out. She'd gone blind. Now, that's very interesting. It's wonderful. But my point, really, in writing it, was what would have happened if the dentist had just gone ahead, cemented it in place, and the lady went blind 3 weeks later. Nobody would ever have guessed it had anything to do with a post crown fitted by the dentist.
Don't even make that connection.
No, and that's awful, and it's horrible and scary. Anyway, let's get on with thermal imaging, Danny. Come on. Show us what you got. Right, this is the kind of thing that people will see. So talk us through it. First of all, the colors. Red is obviously inflamed, yeah?
Yes. Just like a street light, red is stop and look. Don't go through the red light. You're danger. You could get hit. And red is inflammation, and the red color. And white is actually a hotter color in the thermogram scan than red.
So it's even worse than red.
It's worse than red.
Oh, wow. Yeah.
This is a young woman, and she's in her 20s, and you can see right away. And she does drink a lot of coffee. And so she's got a lot of inflammation in her sinuses and her forehead area. And the color of yellow means warning. You should stop and take a look at this area. Just check it out.
Well, it's
And
overwhelmed by red, so I wouldn't worry. I just concentrate
right,
on
and
what is
usually,
this in her clavicular area? What's that? I mean, what organ is it? Upper lungs or what? What do you
well, we're
think?
looking here at her mouth area on the right side where she's got some dental issues
Yeah.
going on, leaking down into the lymphatics. So her lymphatics
Oh,
are in
so it's
good.
lymphatics. Oh, wow. So that is
Mhm.
awesome. I mean, what can be learned? This is why, I'm practically demanding the people that watch this that are practicing. You must get one of these damn devices and start using it. And
Well,
I'd be
what,
right, sweetheart. It took you a little while to get wise to this. Took some
yes,
practice, but eventually the picture started to be clearer and
right.
clearer. Yes.
And once your eye gets used to seeing, markers, what I call inflammatory markers, it's very easy for a person to see the outline of their face and see where their cheek is or their eye or their nose or their ear. A
Yeah.
lot of cell phone users are starting to come up with inflammatory markers around their head area and their ear and down in just right underneath the ear, right in this
That's
area.
white. So is that her? Everyone has one side or the other. So she holds it to the
You
left
can
side of
tell,
her
right,
head.
the difference. She's
And
holding
that's
the phone.
white.
Yes.
It's practically frying her brain, poor
Well,
thing.
if you think about it, your cell phone, if you hold it to your ear, it gets hot.
Yeah, absolutely.
So
Yes, that's true. Yeah,
it's radiating a temperature and it's a signal actually,
right.
but they
Now
call it EMF.
the brain part of the skull here looks fairly normal. Greens and blues and purple. Is that
Well, her hair
am I
won't pick
right?
up. Well, she's not bald. So this is her hair.
Yeah.
And that won't image a temperature because hair is pretty much not going to have
Oh, so
a
she's
light.
she's got short hair. I thought it was just
Well, we put her hair
ignoring the hair.
in a ponytail.
Oh, I see. Okay.
So we put her hair in a ponytail to get it off her neck. So we were imaging her neck and the side of her face. This is her right side of her face. And where the caption of temperature is, I find interesting is I try to capture the hottest areas on the features off of the skin, the facial areas, or even the surface temperature is what I'm looking for. And 96 to 77 is the area in the room. People might say, well, how does it pick up the temperature? If you're out in the hot, hot sun, I'm going to have a hard time picking up images. And does that make sense off of the skin?
Yes.
Because the
Yes, of
sun
course.
is heating up your skin. Or if you just came from outside and you were, out of the hot sun. So the room has to be around 68 degrees to 70 to really get the skin calibrated and acclimated to showing the contrast areas of temperature.
Right.
And with her, you could clearly see that she has them. And now on what I have on the lower right side is the top of her head. And
Right. Is she looking down?
she's looking down, correct?
Yeah. So her right side's on the left.
Yes,
Mhm.
and you can
Okay.
see that she's got more heat on the right side than she does the left. But this is, I always find fascinating. And it was a chiropractor who asked me to start taking these angles on the top of the head to show the sutures, the skull bones,
The joins in the skull bones.
the
Yes.
joins in the skull bone. Yes.
Which is fascinating. What was the chiropractor interested in then? Looking for
He
inflammation
was-
in the sutures.
Yes, he was inflammation in the brain. He did a lot of teaching about neurology on the brain and how it affected the joints and the muscles. And so I worked with him a little while, taking these images on his cases. And this was an angle that he really wanted to see. And it was really awesome because I never thought of it. I wasn't taught in thermography school about this until he showed me everybody's head is different, different shapes and different forms. And there's heat coming out of the area of these sutures. Well, joint, or where
Yeah.
you call them, where they're.
Well, sutures is the correct word, of course, but
Mhm.
the join in the plates of the skull. Yes.
Yes,
Yeah.
and they are movable. We used to think they were stuck in cement, but they're not.
Well, the cranial osteopathy people, like I said, John Upledger and his followers, they get quite a lot of movement in the bones and they can reshape the skull, often with tremendous advantage. That's symptoms sometimes just go away just by rearranging the skull bones into something less tight and tense. And
What I find
unmanageable.
really fascinating is orthodontics braces lock the jaw so it can't move. And over 99% of my patients always suffered post braces migraines.
Wow. No, that's shocking. I mean, I don't like using braces, and it strikes me as a very nutty way to go about things, to force the body with metal to adopt some position it doesn't want to. But you confirm that by saying it just all goes horribly wrong if you do. But in subtle ways that the dentist can easily ignore and the patient wouldn't notice. Probably think the migraine is due to something else. So I've got migraine. They wouldn't think, damn, since I went to the dentist, I've had migraine. Nobody ever thinks that thought process through, do they?
No, not yet. Not now that we are doing these images. Now people are getting educated and realizing this was, because of the dental care.
Right. Now, let me remind you of something else that I learned from you. This is probably a good point, but you said you'd noticed that exhibitions and public displays that people who've been vaccinated against COVID all had massive heat inflammation responses. Just tell us what you saw. And we're warning people, this is something to worry about. We don't want to be scary, but you've got to worry.
I was asked to attend a conference and be a vendor. And I had my thermal imaging camera here. Here it is. Very simple to travel with. And people would walk up to my table and want a scan or an image taken. And this was in Southern California, and after about the third or fourth image I was taking on different people, I noticed patterns. And it looked like the person had been standing in front of a bonfire with a lot of heat. When you stand in front of a big bonfire, you can feel that heat.
Yeah.
And I thought maybe it was the beautiful Southern California sunshine. But I started to see it on more than one or two people. It started to be 3, 4, 5. I got up to 15 people. But before I got up to 15 people, and it was free, so that everyone wanted a quick image. I asked, have you taken the vaccination or, the injection? And 100% of them said yes. Some of them were on their second. And after that, I started to see the inflammation in the facial feature in the head area, and also lymphatics in the left side of the neck going into the heart area, 100% of the time. And lo and behold, that's the area that gives trouble after you get these injections.
Right. Now, let's be clear. That's not something you see on the typical person.
No.
Like going back a few years before the COVID vaccine, you never saw that particular.
No, not repeated. I would see it now and then, but not on every single person.
Yeah. No, that is, well, it's one more thing to be scary, isn't it? Anyway, thanks for observing that. Now, look, you've got a very interesting case, which I'd like you to show you. It's full of pathology and trouble. So talk us through him.
Oh, this case here? The one
that looks right. Yes, I think
since passed away. Yes, he's an interesting case, and one of the areas that a lot of dentists could, and it's starting to happen, communicate with the medical professionals. It's so simple. I just had him take the bottom of his tongue and touch the top of his palate to see underneath the tongue the circulation of the arteries. And his was very weak. As you can see, they're not dark purple. It should be dark purple.
Oh, for veins, yeah.
For veins, right. And it would give me a clue about the circulation of his heart. So there's a lot of information we can gather about the medical body, just screening and looking at this. When you look at his case, he has a lot of dental.
A lot of metal. Is this all metal or silver
this
fillings?
Is all metal.
Dentist? Yeah. So his mouth is full of very toxic metal, mercury, and God knows what else, but certainly mainly mercury, isn't it?
Yes.
Oh, wow.
Yes. And so one thing you talked about, gum disease, unfortunately, you don't have people checking your dentistry unless you go to another dentist who can say the dentist before you didn't do it correctly. You could live with this for years in your mouth, not knowing that it was incorrect. And if it's incorrect, it could be a place where the bacteria can just live in just in masses, and they're never disturbed. And that's what happened in his case.
Yeah, we call this chronic pathogen colonization, and you get biofilms as well. So
Yes.
you're obviously very familiar with that. But this is a great stomping ground for those beasts, isn't it? You know, they wouldn't have
they're
such a good time against your tooth. But once your tooth's been cracked open, drilled, and filled with garbage, oh my God, it doesn't bear thinking about. Is there anything else to see on the photos of his mouth before we go and look at the imaging?
Yes, there's one area here, and this disturbed me when I was working on his case. I don't know if you can see that metal implant.
Oh yes, these are implants. Titanium implants.
Titanium, and right to the right of it, you can see a big area that's dark, and that just means that there's an infection. And there's also some dark gray area here around there. He was actually, any bacteria getting inside that body was easily accessing the body from the mouth through this implant.
Right. Now, was he suffering pain from that bone infection to the right?
Not at all. It's silent. Yeah. That's the scary part. All this bone infection is silent for years and years, and it could be till you die.
Yeah.
But what happens is it grows fungus, it grows gangrene type bacteria in the jawbone, and it leaks into the brain. Like you said, Parkinson's and dementia. I've seen it. I've seen bacteria travels. It doesn't stay put. And fortunately, Colgate did a good job years ago selling their toothpaste, educating the public that gum disease can, infect your heart. Right. But that's as far as it got. We know now it's not just your heart, it's other organs in the body, especially the brain, because it's right there.
Right. Oh, this is so scary, Victoria. And people are worried about a little virus running around in the community. I think this is much scarier.
Well, that's why we go into, like I said, the imaging, because if we can just get the dental offices to work with imaging, it's simple. I can teach in a dental hygienist how to take 3 images, the front and the sides. Both sides, one side, the right side and left side, should easily mark the inflammatory markers and say, you're not well. And the next step is to work with a team to get well.
Yes, of course. So this is that man we were just looking at with the
This is the same person, that man. Yes.
Right. Well, I mean, the first horrible thing that's striking is look at his neck. It's on fire.
It's on fire. He complained. We didn't read the notes because I do take time. He complained that he had a lot of mucus in his throat.
Right. Well, I guess that would be. I mean, he must be just swallowing continuous
and coughing,
pathogens,
right. Mm-hmm.
And it's these very toxic as you say, fungus as well. Not just bacteria, but fungus viruses, mold, protozoa, mm-hmm. but all kinds of things. Anyway, listen, I keep interrupting, but what you're saying is so fascinating. Talk us through these 4 images and what you can learn from them.
Well,
please.
What my frustration is, and what I've learned from him, and just doing his scan last summer, is a timeline. Usually, we have early, wiggle room where he has maybe a year, 2 years to go get this fixed, or look at, go work with a team of wellness care practitioners to start his body healing. Reverse it is what I would call. But at least we looked at it, and we can see that even if you can see in the top of his head, he wore a hat all the time, and that was irritating to his skin. But what I found interesting is you can see here his
That's
heart.
A man? You're talking about breasts, but that's a man, yeah?
This is a man, and he's got heart inflammation.
Oh, look at that. Oh, gosh. Oh, he's a goner. And as you said, he did actually die precipitately. Yeah,
he died.
Didn't last long enough to get fixed.
Well, when he got the COVID virus, the beginning of December.
Oh, that would finish him off then in this condition. Because his immune system is already stressed to breaking point.
You just, exactly. And it wasn't the COVID, it was his weakened, very weakened immune system. And many months, and I tried to encourage him to see somebody to start getting well, but he tolerated the discomfort and just put it off. And it's really important, these scans at dental visits, to help patients not put it off.
Yeah, well, I must say, so he looked at these pictures and put it off. I'd look at these pictures, I'd run, not walk to the nearest hygienist and say, let's make a start now. Wouldn't you? Well, of course you would. That's your profession. But yes, I mean, it's just scary. And what about the armpits, Danny? What's happening there? Look at his armpits. Lymphatic. They're white.
Right.
Oh, yeah, lymphatic collection. Yeah, yeah.
And he also, his lungs too, you can see here, were not doing too well, especially his right lung. And he had pneumonia.
Subclinical pneumonia? Had he been diagnosed with it? Or do you think
yes,
it's just subclinical?
His breathing got so bad that it went, I really didn't understand about the oxygen level numbers as well as I did being around him and learning from doctors. Oxygen levels should be around in the 90%, and he was down to 60.
60? My God, it's wonder he wasn't blue. Did nobody notice?
And he could hardly feed himself. I helped nurse him for the first week before he went into the hospital, not realizing how I knew his scan. I had seen it. I'd taken it. But at the point he was a 911 call, it was past the prevention, early intervention.
Oh, yeah. Yes, 911 for you overseas. That's the emergency number you call. Help! You call 911 and ask for an ambulance. Yeah, anything else on this man's pictures and his? I mean, it shows the photographs at the beginning. His mouth looked really quite ugly. It was a mess, wasn't it?
It was, and
no dentist should be proud of a mouth that looks like that. That's, well, I mean the one above. Yeah,
right. He had a lot of wear on the teeth, which meant his bite was off. His misalignment, and he's chewing on surfaces that are not in. His chewing surfaces are off. And his palate here is parched, which means he has limited airway. That was the other thing too. On one of these photographs, I have them say "ah" when I'm taking a picture, and you can see as he's saying "ah," you can't even see his throat.
Well, that's true. It's supposed to open the back of the throat. Yeah, that's right. That's why dentists do that. Yeah,
but nobody's doing it anymore. You realize that? I have never heard a dentist say, "Tell me ah," or a medical doctor.
They used to depress the tongue so that you could see. Now, I'm just looking for that. Yeah, James Nestor. Let me just get it from my shelf, sweet. If you've not read this book, you'll enjoy it. And you probably have anyway. I hope you can see that.
Oh, yes, Breathe.
Breath. And it's by James Nestor. And he's calling it The New Science of a Lost Art. He's talking about breath and breathing, of course. But the overlap between what you're saying and what he's saying is so, one is confirming the other. And he's talking about, bite and occlusion and the shape of the palate and all kinds of things, how that influences breath. Like I said, it finally comes down at the end to actually chewing properly. He went to Paris and to the catacombs and looked at centuries of old skulls and realized, as you realize and I realize, that modern people are not very healthy in the orofacial area. Teeth are often cramped, the arches, the jaw arch is collapsing. So different from Western prices things. Remember those beautiful pictures of native black men's teeth? It was like this big, an arch like this, and we have to make do with a teeny arch like this and try and fit all the same number of teeth. Just doesn't work, does it? Anyway,
that's why chirodontics is so exciting, because as a child's growing, working with a dentist and a chiropractor together in sync, and seeing each other on different days and during the week, and coordinating their visits. So after you have an adjustment on your bite, you go to the chiropractor and he works around the bite, or vice versa. So you have this synergy of balancing out the jaw and the bite and the skull bones, and the facial features look phenomenal. It almost takes 10 years off somebody's facial features.
Oh, that'll be popular. Oh, well, let's teach them.
Right.
Yeah, but I think a lot of people won't get this. They'll think, well, I can chew a burger. What's the problem? My bite's fine. My teeth are good. I can crunch an apple. But the truth is, isn't it? If it's off even by 0.5 millimeter, sooner or later, the toll and the stress on the jawline and the other surrounding bones is going to take its toll, and it will cost you. Not necessarily cost you your life, but you can't build health with a crappy oral facial area, and it is the crappiest area in most human beings. I know
Yes,
crappy
and
isn't a technical term, but
you're absolutely right. Yes. And I ask my patients when I was practicing clinical dental hygiene, and I use this example to this day. Have you ever been to the beach and have you ever gotten a piece of sand in between your teeth stuck? And you bite down and you can feel that sand in between your teeth as you bite down, you feel that sand.
Yeah.
I said, that's how delicate your bite is. That's how sensitive it is.
Yeah.
That little piece of sand can.
Yeah, a thousandth of an inch. You can feel it. It'll bang a little bit early, and that'll start to hurt the tooth, and then you get pain. And it's only because of a 1,000th of an inch hitting sooner than on the other side. It's incredible, isn't it? Anyway, listen, let me ask you some specific questions then, just to help people understand more. This is fascinating. This is absolutely fascinating, Victoria. It really is. But what was he died? The poor guy died because he left it too late and didn't do anything. That he ran out of time. But what was your program? How would you have helped a person that came in with all this garbage in their mouth and in this terrible immune deficient state? What would be the program?
Well, everybody's case is different and it's customized according to their imbalances. So first we would take the information verbally and visually with images and questions. The software that I designed is designed with algorithms that gives a scoring system. And this is what I feel is very exciting because the Germans taught me there are only really three systems in the body to analyze and to assess. The chemistry in the body, which they call biochemical, the biomechanical, which are your bones and your muscles, and bioelectrical, which is your emotions and your nervous system, your brain. And when I take these assessments, believe it or not, thermography can help me discover which tooth. By looking in the mouth, I can look at this and tie it to thermography. And then through the system, and I'll scroll down here, I'm able to put the information into the software and come up with scores. So if their score is in the healthy area, it will read between 0 and 25 and give me an idea of where area in the body is out of balance, where they should start based on their answers. But
you've rushed. Just go back to what you're saying, because I was trying to look at this as here. I was trying to look at this as the, our visitors will look. So you've got 0 to 25 is healthy. If it's 26 to 50, that's worrying. And if it goes beyond 50, it's
then
dangerous.
Problematic.
For each of these systems, yeah?
Yes.
Okay. So can you tell about a person's emotional state by looking at the thermogram?
Yes, and I love to, because the way that they answer their questions, they might say, I don't have a problem with my stomach, but then their stomach is red and inflamed because I took the thermograph image, and I delve a little bit deeper into their emotional state, and they'll say, well, I am going through a divorce. So it's a lot of information, even though they tolerate the discomforts in their health, will show up. I always call it my glass house report, because they can't lie, and the mouth doesn't lie, and not when I look at it and I report what I see.
Yeah, listen, I'm going to book a flight over. I'm going to come and see you next week.
I hope so. That'd be great.
It's very important. Now, for the practitioners who are watching this, I can't imagine one that isn't going to be gobsmacked, as we say in English. I don't know what blown away is an American expression, I suppose. They're going to want to do it. So how does a person get going with this and to be able to do it? I mean, do you run courses, or are you willing to teach and train people that say, how could I have one of these, Victoria? Tell me what to do. How can we help people like that?
I started 3 students last summer, and it's easy, actually. They just have to want to do it. And I help them get started with purchasing the equipment, and they purchase a subscription of the software, and they I have online courses that they purchase and watch. And because of the pandemic, a lot had to go online. Now that it's, changing a little bit, I can either fly out to visit them in their office and teach them how to use the camera, or they can come to Las Vegas I teach them, and I was teaching on-site classes how to image someone that was live. As a practitioner, when we were in school, we worked on live people. First, fake people, right? Fake cadavers, and then
Dummies,
real
yeah.
people. So it's just all about practice. A lot of what they're doing, they know already. It's just taking it and widening their scope of assessment. They've been assessing, but with limited information. Now I give them a tool to assess with, and now I just opened up Pandora's box. And it's more exciting, and it's more fun, and it's better for the patient.
Yeah, wonderful. Listen, sweetheart, you've done a lot of good in the world. If you were to die tomorrow, you've left a marvelous legacy. I hope you don't. I hope you go on another 50 years, of course. But it's been marvelous, and I want to share, and I'm going to share that. I've got 150,000 odd people that would love to know more about this. I hope you're going to be able to field for us, so that when the questions come through, I can pass them on to you, or give them a link. Now, is there anywhere you want them to go? Is there a website where
Sure,
they go to visit this site, and I'll make contact with you?
Sure. A lot of people ask me why I chose the name Tangram.
Oh yeah. It's a little Chinese.
It's a Chinese
puzzle with
puzzle,
shapes, isn't
right?
it? Yeah.
And it's what I like about it is that it helps to understand that this little tangram can be visualized in over 1,000 different images, just like your health. And everybody's health is different, and it's customized care. And one of the things I want to mention before we close out is, you said, how can they find out what's their next step? Using the scoring system where they're out of balance, they can now say, my muscles are causing my immune system to be weakened. I need to have my structure, or at the same time, their chemistry. So it's really right now in the hands of the consumer to create a team of practitioners that specialize in chemistry, changing in your body, your chemistries, and then mechanics, and then the electrical, your emotions, and also your mental state. It's very important to put this team in place. And right now I'm just joining a new center called Back to Balance Las Vegas. And it's very exciting because what I'm bringing into their center is a piece of that puzzle that will help them be able to customize care even better. It's called care integration. And but where people can locate my site of information is Tangram Integrative Health Solutions. So it's tangramihs.com.
Tangramihs.com. I'll put the link there so that people can click and find you. Do you have a book, Victoria? Anything like that?
I've been asked about writing one. It's just
it's hard work, I promise you. It is, but
I would love to.
I think you should.
What's missing is the dental hygienists are so knowledgeable about implementing this into the hygiene department in dental offices. It's been a real challenge, Dr. Mumby, to get the dentist to agree to this. And maybe you could say something here, how important it is for dentists to take the time to take these screenings, because a dentist I met with this week, she mentioned to me she was hesitant to do this because she might lose her dental license.
So things are so bad, huh? If you do it properly, they're going to pull your license, because all the ones doing it badly don't want to be embarrassed.
No, but why would she say that, other than her fear of seeing something inflamed in the head and neck area, and she's out of her comfort zone? Perhaps.
Yeah, and maybe it's like postmortems. American doctors won't do postmortems because they know if something showed up that got missed, they're going to get sued. So we don't want to know. We don't want postmortems. Maybe that's the same kind of idea then. Yeah, it might show her up, but I can't believe that degree of fear really for practitioners. It's so sad.
It's
but
very real.
I do understand it. It's a real fear. And it's always the good guys that get hit, and they're not always, but if you stand out, you're going to get hit. Let's put it that way. It's the tall poppy syndrome cubed and gone crazy.
And there have been dentists, the biological dental associations in the United States. These dentists have really tried to pull in the medical screenings, but the American Dental Association kind of slaps them on the hand and says, don't go any further. But Fortunately, that is changing, and the medical professionals are starting to want to collaborate with the dental professionals because the patient's life is saved sooner than later with these earlier screenings.
Right. Yeah. Well, there's a lot to think about in what you've taught us. And it's obviously a huge and important area of health and hygiene that people have just got to know about. I'd like to think of the public at large, the average person, creating the demand. You know, that's the way I chose back in the 80s. Food allergies, most doctors would just, it's rubbish. You know, what you eat's not important. What do you mean? Cause cancer or cause arthritis? Nonsense. So I appeal to the public, and after enough, you should do the same. After enough appearances on radio and TV, the public went to their doctor and said, "Could this be a food allergy?" So hopefully we can create a demanding public, knowledgeable public that will say, "Hey, I want a thermogram on my head area, and I want you to explain to me what is going on." And fix it. Yes. Victoria DaCosta, you're lovely, you're a darling, and you've been very helpful and very informative. This was an exciting interview, and I thank you very much for doing it.
Likewise.
Take care.
Thank you.